The verifications of school opening criteria in 2020 of Shandong Province. First, school system construction and mechanism establishment. Set up a leading group for epidemic prevention and control. Check whether the divisional responsibilities are clarified, whether the special research on epidemic prevention and control is conducted, and whether the prevention and control measures are carried out. Set up Supervision Commission of Epidemic Prevention and Control. Check whether the school has implemented supervision and had routine inspection records. 4 levels, including schools, grades, classes, parents of prevention and control contact network. Check whether the contact network is normal on site and whether information is collected and submitted in time. Cooperate with health, public security, and other departments. Check communication network by calling Design Medical Institute and police station for inspection. Today, we have Mrs. Li, the Deputy Director of School Health of Shandong Provincial Center for Disease Control and Prevention. Could you please explain to us the importance of this system construction? There are very strict requirements for the construction of the school system in the detailed rules of verifications. The Ministry of Education has put forward the guiding ideology of unified leadership of the party community, unified management of the party and the government, coordination and linkage of sections, comprehensive coverage of teachers and students, and close cooperation between families and schools. According to number 118 document of Shandong Epidemic Prevention and Control Command Group, each school should establish an epidemic prevention and control leading group headed by the chief leader, which is responsible for the overall organization and leadership of epidemic prevention and control. And at the same time, the relevant professional working groups should be organized to be responsible for the specific implementations. The joint prevention and control mechanism is also very important, including the multi-level contact system within the school, as well as the contact system with the health department of the local authorities, such as the disease control center, medical institutions, and public security organizations. Clarify the contact person and contact information. Keep regular in touch to get instant response and professional help in emergencies. Two, develop appropriate school plans. School opening plans. Check whether the school's opening plan is developed, whether the plan is reported and recorded to the education authorities. Daily prevention and control plan. Check the completeness of disinfection, temperature measurement, access management, etc. Check with the school staff randomly to see if they were aware of the situation. Emergency plan. Check the feasibility of emergency plan. Check with the school staff randomly to see whether they know the emergency handling process very well. Public opening response plan. Check if there is any specialist staff responsible for public openings, and check with the school staff randomly to see if they are familiar with the process and key points of public opening response. Three, establishment of school system. Epidemic situation reporting system. Check whether the responsible person is assigned and whether the reporting path and the process are clarified. Emergency response system. Whether the relevant personnel are familiar with the specific process of emergency response through random interview. Checking system for teachers and students in the morning and noon. Check whether there are assigned responsible person in charge of each major section. Check whether the relevant staff is familiar with the disposal process after finding problems, and whether the demonstration and records of the staff are standardized. Sanitation, cleansing, and disinfection system. Check whether there are assigned responsible person in charge of each major section. Check whether the place, frequency, and use of disinfectant are scientific and correct. Whether the schools are implemented toilet disinfections and room ventilations. Health education system. Check whether the content and form of education are complete and flexible. Absence registration and tracking system. Whether there is a special person in charge of registration and whether the registration and tracking process is clear. Centralized treatment system of discarded masks. Check the location and quantity of discarded masks and dustbins on the spot, and check whether they are handled according to the standardized requirements. Why it is necessary to specify the responsible person in the establishment of the system. Everyone is responsible for the prevention and control of the epidemic. Specifically, every teacher and student in the school should be responsible for the prevention and control work. The school should implement and clarify the prevention and control tasks and responsibilities. For all staff training. All staff training. Check the training records and videos. Randomly ask the staff at key positions whether they have participated in the training, as well as the training times and contents. Carry out the publicity and education of prevention and control knowledge. Check the publicity and education records. Randomly ask the teachers and the students whether they have participated in the training as well as the training times and contents. Why does the school need to train all the staff? Schools are special places for epidemic prevention and control. The prevention and control works in schools are highly important, unique, social concern, and arduous. Therefore, higher requirements are put forward for the prevention and control of schools. Schools need to publish the prevention and control knowledge and relevant laws to teachers, students, and parents to improve their prevention awareness and legal awareness. Five, emergency response. Emergency drill. Check the records and videos of emergency drill. Check with staff if there is any problem found during the process, or are there any specific rectification methods. Practicing exercises. Randomly select some teachers and staff to demonstrate operations, including daily examinations, classroom health management, suspected patient report, isolation, etc., to see if they are standardized. Are there any effective suggestions for the emergency treatment of schools? Each school shall conduct at least one emergency exercise before the school starts. Through the exercise, let the staff know the content and process of prevention and control, how to carry out daily prevention and control, and how to deal with the emergencies scientifically. Six, comprehensive investigation. Health ledger for teachers, students, and staff. Check whether the health information is complete and sufficient, whether the responsible person is assigned, and whether the reporting path and process are clarified. Investigate key personnel. Check whether key personnel have been investigated and whether the personal health checking records have been filled individually and separately. How to implement one field for one person. In order to ensure the health of teachers and students and the normal teaching order, one field for one person can timely grasp the health status of teachers and students. Once abnormalities are found, early detection, early report, early isolation, and early treatment can be achieved. Seven, material support. Check whether the school is equipped with sufficient and reasonable arranged water taps and hand sanitizers. Check the storage of material and registration records. What problems should be paid attention to in material reserve? Material reserve includes daily protection material reserve and emergency material reserve. The Education Department has issued guidance on material reserve, and schools should use it scientifically according to the situation of epidemic prevention and control and the protection requirements of relevant departments, like not overuse or not over-reserve the material.